take up any more of your time, we do want to hear from our first speaker, Tony Cunningham, the current president of AAMRI, who would like to say a few words and get the evening kicked off. Join me in welcoming Professor Tony Cunningham.
There won't be much humour in this speech. I can't match it with Bernie, I'm afraid. Well, firstly, I wish to acknowledge the Ngunnawal peoples, the traditional custodians of the land on which we meet, and pay respect to their elders past and present. And I'd like to start by thanking all our special guests, I won't go through them again, and our parliamentarians for joining us here to celebrate Australian medical research, and especially Minister Hunt, Assistant Minister Gillespie, Shadow Ministers King and Carr. And I'd also like to thank CSL as well as Bernie. They are truly a great Australian company. We heard today from Anne Kelso that it was 80 years ago that the first meeting of the NHMRC Council was convened. At this meeting, it was decided how to disperse £30,000, which I don't think you did mention, which is the equivalent of about $2 million today. So times have changed. Since then, successive Australian governments have substantially increased investment, growing the sector, so we really stand tall amongst the best medical research nations in the world. Delighted to hear from Sue McLennan today that we're going up in biotech as well. So this investment has allowed our medical research institutes to make some pretty amazing discoveries. 20 million people with leukemia have benefited from being treated with colony-stimulating factors discovered at the Walter and Eliza Hall Institute. Discovery of folate deficiency as a cause of spina bifida at the Telethon Kids Institute has led to its minimisation through food supplements with this essential vitamin. Australian research at the Murdoch also discovered the link between babies sleeping on their tummies and sudden infant death syndrome, and this simple discovery has reduced deaths considerably in this condition. And this year, as Doug Hilton will tell you, there was a most spectacular achievement where a $400 million agreement was signed for an entirely new anti-leukemia drug, venetoclax, also discovered and developed at Weehai, and which offers hope to thousands around the world. And I could go on. The discoveries and development of pancreatic islet transplant for diabetes in 3 institutes, including my own, represented here tonight. So these great outcomes are just the tip of the iceberg. They need to be, as I'm sure Minister Hunt will tell us. We spend over $155 billion every year on healthcare in Australia, and this is going to grow with an ageing population. The best way we can tackle that burgeoning healthcare expenditure is with smarter research-led solutions, perhaps not the ones yet that the head of Amazon would like, as we heard from Ellen Finkel today. Clearly, we need to stop spending on treatments, tests and procedures that provide little benefit or in some cases cause harm. We need more evidence-based medicine with researchers working alongside healthcare professionals, bringing our healthcare and research systems closer together and using our research in a smarter and more integrated way. And we also need to relieve the logjam in the innovation pipeline so we can get our research discoveries out of the lab and helping patients more quickly. But we're making progress. Initiatives like the NHMRC's Australian Health Research Translation Centres, the building of research precincts and new clinician scientist fellowships. Research is now being driven not only by scientists' ideas, but also by the needs of patients, which is exactly how it ought to be. And for clinician scientists like myself, who spent a lot of time trying to push research links with health services and universities, this is really exciting. Too frequently, stretched healthcare budgets have meant that research was seen as a luxury that hospital managers simply couldn't afford. And I've seen that in my own hospital. Research is not a luxury. It's the only way that we can keep healthcare costs down and deliver new treatments to overcome fatal or debilitating diseases, and debilitating diseases that prevent people from being able to work, provide for their family and enjoy life. We've now got an unprecedented opportunity to make this happen. The Medical Research Future Fund is set to double the government's investment in medical research, expanding strategic research and complementing Australia's world-class, outstanding investigator-led research funded by NHMRC. With the MRFF, we now have the support to do much of the strategic research our healthcare system needs and expedite the journey of our best discoveries from lab to clinic. This year, the Medical Research Future Fund has really progressed. It's now a third of the way to its $20 billion target, and it's already funding new clinical trials and backing clinical and public health researchers with the fellowships and the research investment they need. We thank the government for delivering on the promise, and furthermore, we thank all MPs on all sides across the Parliament for your bipartisan support for the fund's legislation, and many are here tonight. Thanks to our friend and tireless advocate, who we sadly lost earlier this year, Connie Johnson, who passionately campaigned with a number of us in this building. But most importantly, thanks to the community, the funders of the Medical Research Fund. They've certainly put their faith in us, and we will deliver as in the past. I'm sure Minister Hunt would agree that when you announce a $20 billion fund, more than a few people will be knocking on your door telling you how to spend it. There's thousands of worthy projects and ideas, so we should all be grateful for the tireless work of Ian Fraser and the Australian Medical Research Advisory Board, who've put together a prioritised strategy for the fund by working with the sector and government. And we also congratulate the government on the investments made to date. We're delighted to see the high degree of contestability for the new funding schemes announced, many through NHMRC peer review processes. Competition is what makes our sector stronger and makes sure that our precious investment is made where it will be most effective, involving Australia's best research groups. Inevitably, there will be winners from the fund, and there might be disease areas, disciplines, or institutes that get a funding boost. Other areas may have to wait a bit longer. However, if you're not one of these, don't despair. We're 1/3 of the way to getting the fund to $20 billion, and we're only going to get it there with everyone's support. Indeed, we've just got one opportunity to support the Medical Research Future Fund to reach its full potential and maintain the political and community momentum behind it. If successful, we'll have years of opportunities ahead of us to put the fund to work and use such research to meet the health challenges facing Australia. I'd just like to say two more things. I'm delighted to announce the next AAMRI President-elect is Professor Steve Westling from AAMRI. But unfortunately, I've still got a year to go, and Steve will take over in November next year. It's wonderful because I can now offload the organisation of AAMRI's 25th birthday party to him. Just kidding, Steve. I'd also like to pay tribute to our wonderful and wise board and our outstanding staff. Peter Thomas, our Policy Director, and the two Catherines. They make my job easy, and Peter's networking, understanding and savvy common sense are of great value to the whole medical research sector. Thanks, and please enjoy.